So I am Dr. Prachi Kathuria Gera. I'm a certified lactation professional. I'm a dentist by profession. Also, I am certified in child nutrition. First of all, I would like to welcome you all and I would like to thank BabyChakra for giving me this opportunity to come here and talk about a topic which is very close to my heart and I'm very passionate about. So, I have this page by the name of My Parenthood on Instagram. I also have a YouTube channel and a Facebook group where I talk about breastfeeding, various challenges, and I help mother through all the information which I share. So you can follow up me there. Also, you can follow me on Baby Chakra. I am here available to clear all your doubts, if you have any. So today we are here to talk about, some common issues related to breastfeeding. See, to start with, I would like to tell to all the moms that breastfeeding is a very beautiful experience. It's a magical experience and it's a right of all the babies. But then it can come up with lot of challenges. So if you don't have proper guidance, if you don't have proper support, then things can become really, really difficult for you. Okay, so today we'll be talking about some common issues which generally new moms face after they give birth to the child, and these are some very important reasons because of which they might end up quitting breastfeeding, or they might be facing a lot of difficulty. So to start with, the very first issue which a lot of my clients come to me and talk about is that I am not making enough milk. I'm having a low milk supply. So in most of the cases, it is the perceived low milk supply. So whenever you'll give birth to the child, you have to remember one thing, that milk is always there. Milk production starts till the time you are 16 to 18 weeks pregnant. The milk is always there. The milk which comes out from the breast in the initial period is very less, and that little amount is loaded with so many components which are very important for your child. The first milk which comes out is cholesterol, and that small amount which is coming is sufficient for your child. So the tummy of your child, when the child is born, the stomach size is so small that that milk is absolutely fine. So you don't have to worry about it, right? The milk is coming at a very slow pace, and am I making low milk supply? So no. But yes, over the period of time, if you think that you are making low milk supply, milk is not sufficient, then you can absolutely consult a lactation professional. But the most important thing you can remember, that more you will latch the baby, more you will feed the baby, your milk supply will keep on increasing. It's all demand and supply. So without thinking about it, I would suggest all of you to just keep on feeding your baby, okay? And don't think that, because it is going to affect you psychologically, and plays a very important role, okay? Secondly, I have seen a lot of mothers coming in saying they are having pain, okay, and the nipples have become sore. So breastfeeding should not be painful at all. In many of the cases, people around will tell you, okay, it is, if it is paining, it's okay, keep on feeding your baby, it is normal. No, you have to understand that breastfeeding should not be painful. Yeah, a little pain initially, in initial days when you are trying to latch your baby and the baby is trying to learn it, is okay, that is fine. But if you are experiencing a pain throughout the session, it means there is an issue. You need to consult a lactation professional. I would like to very quickly tell you, the most common reason for sore nipples and pain is that the latch is not proper. Latch is the way the baby is going to suck the breast, the way the baby is holding the breast with the mouth and sucking. It means there is some problem in that, okay? Or the way you are holding the baby, that can also have some issue. So very, very important that you need to consult a lactation professional. Secondly, try to heal that. Make sure you are taking all the measures to heal the nipple. Keep on applying breast milk over it. Consult a lactation professional or a gynecologist to suggest you some ointments which can be applied so that it heals, okay? Also, if it is so painful that you are not able to feed, take a break, till the time you talk to someone, and start hand expressing. Okay, express the milk out so that the milk production is not affected if you are not latching the baby. Then the next common thing I've seen is engorgement. Okay, and I think most of the mothers face this issue in initial days as soon as they give birth to the child on day 3, day 4, or maybe day 5. So what happens is, initially, as I explained, that the milk supply is very less. Okay, like the milk is always there, and then gradually as the baby starts sucking the breast, the milk supply keeps on increasing, and it increases so much that by day 3, day 5, a lot of hormones are laid down, they are increased, and the milk supply increases. So sometimes what happens is that your breast becomes very tight. Okay, and it becomes very hard, you feel a lot of pain. Why? Because the milk which is present inside the breast is not emptying out at a speed at which it is being produced. Okay, so it can be that the baby is not latching well, the breast is not getting empty, baby is very sleepy, or maybe you are not holding the baby in the correct manner, so that the latch is not effective and the baby is not emptying the breast. Okay, so engorgement is not a good sign. If you're feeling heavy breast, it is not a good sign. A lot of mother thinks, okay, the breast is heavy, it means I'm making a lot of milk supply. No, it should not be ignored. If the breast is heavy, the breast is tight, the baby might also find difficulty in latching. So very, very important that immediately you pay attention to that thing. You can make sure that you are latching the baby very frequently. If the baby is sleepy, try to wake up the baby, try to empty one breast at a time. Still, if it is not getting resolved, try to massage your breast very gently. You can do hot fermentation, you can take a hot shower and express the milk so that it doesn't collect inside, and it can lead to a lot of inflammation. If things are not getting resolved within few days, please consult a lactation professional or your doctor, because this engorgement, if not resolved on time, can lead to a lot of infections. Okay, next very common issue is that, which I think every mother has doubt, that my baby is crying a lot. Okay, and is my baby hungry, and also is baby getting enough milk or not? So this is a very common question. So first of all, to start with, I would like to tell you that crying is a very important part for a child. It is the only way of communication. So it's not that they are only crying because they are hungry. They can cry because of lot many reasons. But yes, breastfeeding is the best way to calm them. Whether they are crying because they are feeling lonely, they want to be held up, they are feeling cold or hot, they are having some diaper rashes, or maybe they're having some problem in their stomach, maybe they have as simple as a mosquito bite. So there can be a lot of things, and breastfeeding is the best way to calm them down. So if in initial days the child is crying, it's okay, don't get panic, just leave them and breastfeed them. Okay, secondly, if you are having any doubt whether my child is receiving enough milk or not, my child is hungry or not, or like, am I making enough milk? There are few things which you can take, you can keep in your mind. Just keep a check on pee and poop count. If the child is peeing, that is the urine output, which is more than 6 times in 24 hours or equal to 6 times in 24 hours, it means that is fine. Number two, the child should poop at least once daily. Okay, so if these things are in they fall in this category, you don't need to worry. Third thing, you can get your weight of the baby assessed by your pediatrician on regular intervals, because that will also tell us whether the baby is getting enough milk or not. And the last thing, if the baby is doing fine, all milestones are getting achieved, so you don't need to worry. Just keep a check over when you are at home. You can keep a check over pee and poop count, which will tell you that your baby is getting enough milk and you are making enough milk. But just don't doubt yourself, and don't just switch on to other alternatives just by thinking that baby is crying, the baby might be hungry. So keep on feeding. More you will feed, more milk you will produce, and more the baby will get satisfied. In case of any confusion, please consult a lactation professional. In case if you feel things are not getting resolved, there might be some issue which you might not know about. The latch might not be proper, the position might not be proper. So very important that take consult from someone before deciding something for yourself. Okay, The last thing which we'll be talking about is that a lot of time, mothers, when they deliver, the baby don't latch. Okay. And they come up and tell us that, the baby is not latching. Their baby was not latching. Okay. So, yes, there might be some cases in which the baby might not latch. Now, what to do if the baby is not latching? First thing, very very important, that you need to give some time to the baby and to your body also. Sometimes the baby might take time to learn, you might also take time to learn, but we have to understand that it is the instinct, the natural instinct of every baby, that they will go towards the food. Okay, they will suck the breast. So there might be some barrier which is stopping them. Okay, till the time you find out that barrier and you consult a lactation professional, you can follow few things. Stay positive. Okay, practice lots of skin to skin. Okay, keep your baby over your chest, bare chest, so that the baby gets comfortable, with the breast and with the smell of the breast, so that it is easy for baby to latch. Okay. Secondly, if the baby is not latching, it's okay, don't stop. You should immediately start hand expressing. In most of the cases, what happens is the baby is not latching. uh, at the similar time, the baby is put on to other alternatives. Okay, and the mother thinks that maybe I'm not making enough milk, that's why the baby is not latching. But it's extremely very important that you should start hand expressing, so that your breast is continuously stimulated and the milk production, is settled and is regulated over the period of time. And the milk which is being expressed can be given to the baby with the help of, specialized tools which are available. You can give with the help of a cup, with the help of a syringe, or with the help of, dropper, or a palada, which is available in the hospital. So very very important that you should start hand expressing. Secondly, you should try different positions. It's not that if you are trying to feed the baby in one position and the baby is not latching, it means that's the end. No, you should keep on changing the positions and you should try to feed the baby. And then it is really important that you should consult a lactation professional who can help you with various other ways, in by which the baby can be latched. Okay, so very very important. So the message here is that if the baby is not latching, it's okay. Start hand expressing, start pumping, and start giving express milk to your babies. Please don't get into, starting off the top of feeds immediately. Okay, because that can lead to a lot of that can lead to a top up trap, which is like, if the baby will start drinking a lot of top feed formula milk, then baby might not feel hungry, and the baby might not take breast milk. Okay, and the baby might also not try to latch. There would be a little bit of preference, towards that formula, especially if it's given by bottle. So very very important that you try to consult a lactation professional and start hand expressing inside that case. So there can be a lot of other issues, but I have discussed very common issues, which are generally, we bring to our notice, in our daily life scenarios. Okay, so okay, we have a question, so we'll start taking one by one. I am experiencing low breast milk supply after a C-section done about 2 months back. How can I increase the supply? Okay, so see, very, very important. You need to understand that now the baby is 2 months, and if you are experiencing low milk supply, um it might be that you have introduced, you might be, you might have introduced, some alternative. So we cannot stop it immediately, but to increase your milk supply, I can suggest you few things. Number one, start practicing lots of skin to skin. Very, very important. Keep baby over your bare skin. Number two, try to latch your baby every time you feed. Like, let us suppose if you're giving any other alternative also, if you're giving top feed, then try to latch the baby before that. Okay, very very important. Because, and also try to latch the baby when the baby looking at the baby's early hunger cues signs. Don't wait till the baby starts crying and the baby is very very hungry. No, don't wait till that time. Number 3, try to get your latch and positioning. It might be that you are not holding the baby in the correct manner. That's why the baby is not able to latch, or you are not putting your breast inside baby's mouth in a very correct manner. Okay. Also, don't forcefully put the breast inside your baby's mouth. Keep a check over your diet. Have a diet. Have lots of water. Keep yourself hydrated, and you can also start pumping to increase your milk supply if your baby is not in getting satisfied at the breast. So you can start pumping whenever you get time, and also get in touch with the lactation professional so that a schedule can be made, so that you know when to pump and how to go about it. There are certain techniques like supplement nursing system at breast, in which like if the milk supply is less but the baby is latching well, we can give formula at the breast, or we can give expressed milk at the breast, so that the baby keeps on sucking at the breast. The breast is continuously stimulated and the milk supply increases. Okay, so you can follow all these things, and I think that would be helpful. The most important thing is just trust yourself, stay positive, and just believe in yourself that you will be able to do it. Okay, and please get in touch with a lactation professional. Okay, I'll just see if we have other questions. I experience an increase and decrease in breast milk supply. How can I manage this? So, see, this is absolutely normal. You don't need to think a lot about it. Okay, it happens. I tell you why you must be saying that. Initially, when we give birth to the child, initially there is as I explained in the early part of my session, that the breast milk increases a lot. Okay, so mother feels a lot of heaviness in the breast is leaky, but gradually over the period of time the milk supply is regulated. Okay, so that's why you might think that I'm not the milk supply has decreased. Also, mothers start thinking that, because what happens is initially the babies might be feeding on the breast for like 15 minutes, 20, 30, 45 minutes, and then as they grow the time might increase. They might just feed for 10 minutes or 15 minutes. Okay, so I would like to tell you that babies are very smart. Their body knows that when they need more milk or less milk. Okay, very very important, don't miss any feeds. Okay, keep on feeding your baby frequently. Don't miss any feeds. Like, let us suppose you have fed your baby and then you have skipped 2 3 feeds, and you have given maybe a alternative in that between, because you haven't mentioned here, so we'll be taking all the scenarios. So don't miss any feeds. Keep on feeding your baby regularly, because more you will feed your baby, the milk supply would be regulated. Your breast would know that at what time more milk supply is required, at what time less is required. Your body will know about it, because that actually is regulated by the way the baby sucks, for the time period the baby sucks. Okay, so it's okay. And as I think sometimes the mother starts thinking that their milk supply is decreased, especially during the evening hours, because the baby wants to suck more and more during that period of time. These are known as cluster feeds, and that is absolutely normal. Babies go under so many growth spurts, and they want to cluster feed. They want to feed again and again. That is also a sign to our body that baby wants more and the milk supply increases. So the only thing for you is just keep on feeding your baby. Just don't worry about it. Okay, and don't skip any feeds. Okay, okay. And still, if you think there is an issue and you are facing any problem, you can always consult a lactation professional if there is any change in your routine, if you are very stressed out. So those things have to be taken care of. Okay, so the next is, how can I manage breast engorgement? I've discussed this in the early part, but I'll just quickly repeat. Don't ignore it, number one. Number two, keep on feeding your baby frequently. Try to finish one breast, then switch on to the other breast. In many of the cases, mothers do that. They feed from one breast, and then in 5 10 minutes they switch on to the other breast. No, try let the baby finish one breast and then try to switch on to the other breast. Number three, if the baby is very sleepy, try to wake up the baby, try to feed the baby. If things are not resolving, try to do some hot fermentation. You can take a hot shower. After that, you can massage your breast very gently, and you can try to hand express the milk. Okay, so that you are relieved from that pain, and then try to latch the baby. Because the way the baby will suck over the breast, that is the best way. The vacuum which is created when the baby sucks over the breast, that can empty the breast with a very high speed, that cannot be mimicked by anything. Okay, then if the baby is not latching, keep continuing hand expression. If still you are having a lot of pain, you can do little bit of cold compressions in between the feeds. Okay, you can give a little bit of cold compressions, but only for 5 minutes or so. Okay, and still not getting resolved, please consult a lactation professional. Very, very important to check if the latch is good, if the positioning is good, because sometimes the position in which you are holding the baby and the way the baby is latching are not fine. Okay, the latch is not deep. That's why the milk transfer is not happening, the milk is not getting out of the breast, and it might also lead to engorgement. But please don't ignore it, because engorgement can lead to a lot of infection later on. My twins feed at different times, which gets very difficult for me to manage at times. Please give some tips. I can completely understand. Managing twins can be very, very difficult. See, it would be great, if you try to feed them at the same time, because you can feed them in double football hold, and like you can feed them at same time. But it's okay if that's not possible. You can feed one baby, and side by side you can express for the other baby. Okay, you can express for the other baby. If you think, like, I have just fed the baby, and then after 5-10 minutes the other baby would be asking for the feed, I know it can be difficult. So you can start expressing milk while one baby is feeding. You can use a pump to empty the other breast, and that milk can be given to the other baby as soon as the baby gets up. So this can help you out. Okay, because I know to get the baby on a same schedule can be little difficult. Okay, also, you can consult a lactation professional, so as to get a proper schedule of it. You can just share the full schedule, that how, whenever, how it is going throughout the day, when the baby is getting up and when the other baby is not getting up. But just trust me that your body makes enough milk, for the twins also. So don't think that, like, while you'll be feeding one and the pumping for the other, it might reduce the supply. No, you can always do by this, so that you, so like, for one baby, but make sure that both the babies are fed on the breast. Okay, it's not that you are giving pumped milk to one baby and the other baby is feeding. You can just go alternate. Okay, one time you can put one baby on the breast and you can express for the other, and the next time you can put the next one, and you can uh, put the breast and you can pump for the other. You can go by this way. I think this is going to help you. Okay, also, if you think you are feeding one baby, okay, what you can do is try to pick up the other one and try to latch. It's okay, sometimes they do latch, and then gradually you can come up into that routine where you might be feeding both of them at a time. Okay, so I think we are done with the questions. I have taken all the questions, but still, if you have any doubts, you can always leave the questions, this below this session, below this live, and you can also follow me on Baby Chakra. I am enrolled there, and I'll feel really happy to answer all your questions. To all the moms who are breastfeeding, I would just like to tell that. The journey can be very challenging, I understand, but just try to seek for help, try to get some guidance, try to seek support from your family. If things are not working and you end up trying some other option, you took some other decision for your baby, maybe let us suppose you opted for an option of top feed or maybe breast pumping, it's completely fine. Don't be in any kind of guilt. Whatever decision you took for your baby is the best. But if you have any doubts, any issues, before, without getting influenced by the people around you, seek for the help from the professional. Okay, so do follow me on Baby Chakra, and please do share your reviews and whatever queries you have with us. Thank you so much. Take care.